People faced with barriers to healthcare might have problems with insurance coverage or income, but there can also be many other barriers connected with housing, transportation, or a lack of access to food and childcare. Helping families overcome those barriers is central to the mission of a new nonprofit private pediatric practice in Boston's South End. We'd like to welcome the founder of Boston Community Pediatrics, Dr. Robyn Riseberg. Thank you very much for being with us, Doctor.
Thanks so much for having me.
So I want to talk about your own background before you opened this practice, because you were the head of pediatrics at the South End Community Health Center, and before that you were an Albert Schweitzer Fellow, which means you were sort of dedicating yourself to helping the underserved. So how did that prepare you for what you're doing now?
Well, I think I was an Albert Schweitzer Fellow while I was at UMass Medical School, and I went to medical school knowing that I really wanted to take care of underserved patients and really try and do something about the health inequities in this country and frankly in the world. I was actually inspired to go to medical school based on some experiences I had around the world in India and other countries in Southeast Asia. And really, as I was in medical school, realized that there's so much to be done in this country and in our own neighborhoods. And so that's where I ended up at the South End Community Health Center pretty soon after residency and stayed for almost 15 years.
Well, one of the principles involved in helping the underserved is that to get access to good care, you got to help them with other things besides that. So how does that fit into the equation of this new practice?
Well, that is really at the basis of this practice. And so our whole philosophy is really to meet the patient where they are and see what the patient needs are and how we can affect them and help them. And so, we really will have lots of integrative services, because I know in order to take care of patients' medical health, you also need to be able to take care of their mental health, as well as the social determinants that affect their health. And so all of those things that you mentioned are critical to really treating a patient's whole health. And that's how we'll be looking at it at Boston Community Pediatrics. We will have an integrated mental health clinician, probably more than one, and we will also have a director of wellness and care navigation, because we know that we can't take care of patients without a huge amount of support from within our organization and also other services within the community. So food access is important. We'll be asking families about that. We'll be asking about housing, domestic violence, education, childcare, employment, all of those things that we know are important to families. And then we're going to say, how can we help?
Well, part of your plan is a mobile medicine van or medical van, and also a lot of telehealth. So how is that going to work out?
Well, when COVID hit in March, I worked every day for 3 months trying to change systems and treat patients. I was the only pediatrician where I was working, testing COVID patients and seeing sick kids, which I find to be extremely important during these times. We don't want people to forgo care because they're worried about getting it. And we need to be out in the community testing people for COVID so that we can help stop the spread. And so during that time, I really realized what a barrier transportation was. It's not something that I didn't know before, but it became so apparent during COVID and during the pandemic. And so the idea that I came up with is if we could go to patients' communities and where they live and actually provide medical care there, that would really be such a huge asset to so many families, especially if you're a single mom and have multiple kids in multiple different schools and you're working yourself. It's really hard to be able to get to the pediatrician, and it's also hard. You may have to take multiple different modes of public transportation to get there. And so that's where the mobile medical unit comes in. We can go into patients' communities, we can provide healthcare there, and then we can also have some of those wraparound services with us. So like my ideal scenario would be that we would be providing care in a community. We'd have a Zumba class going on. We'd have someone delivering fresh fruits and vegetables. We'd have other organizations that families would want to access right there with us. And then as far as telehealth, I think what I've found over the years is that a lot of times families don't need to come into the office to get their needs met. They may have a concern that they want to talk about with the pediatrician. They may have even a rash or something like that that they are not sure what to do about. But if we can be accessible, if we can take a look at that rash and then give the family advice and say, maybe try this, and if this doesn't work, then I want to see you, that saves people. I mean, it would save me lots of time. It would save you, it saves anyone time, but especially people who have less time in their day to be able to get into the doctor.
Well, in the best of worlds, this approach is what's known as concierge medicine, theoretically available 24/7. That would be hard for anybody to pull off, I would think. But why is that more than just a luxury?
Well, I think it's a right. So healthcare is a human right. And I think the care that I would expect or want for my own children is the care that I plan to provide here. I think everyone deserves the highest quality care for their children, their most precious possessions. And so we have been known to be called as an equity concierge provider. And I think we will be on call 24/7, just like any other doctor would be, and we will be available. That doesn't mean I'm going to be going to someone's house at 3 a.m. But if someone does need, if they do need help, if they do have a question, if they're worried about their child, they'll call me, they'll wake me up, and I'll talk to them and give them the advice that they need.
Another thing that's in your vision here is that this is not just about healthcare professionals solving all the problems. You mentioned the importance of relationships, even relationships outside your own practice. How does that fit in?
Well, I think there's so many people and so many organizations in our community doing amazing work to help families. And I think there isn't always that huge intersection between healthcare and a lot of community organizations. And I hope to really be more engaged and involved in the community and have patients come in to get medical care, and then for us to be able to refer them to people that we know that are doing great work. That's why we're going to have people on site. Again, I mentioned the director of wellness and care navigation, and then eventually I'll hire another care navigator that know all of the local community organizations in different neighborhoods and what they're doing and how we can connect families with those.
Now, the one thing that is, I guess, maybe striking in the way your practice is described is called a nonprofit private practice, which sounds almost like a contradiction in terms. I'm sure you were aware of that. You had this figured out. So how does that work, that is both private and nonprofit?
Well, most private practices in general accept private health insurance, and private health insurance reimburses at a much higher rate than Mass Health, which is our state's Medicaid insurance. And so in order to make a private practice that is predominantly for Mass Health patients work, although we will have patients from all insurance backgrounds, we needed to have an additional revenue source because Mass Health reimbursements for primary care visits currently are much less than private insurance. That's no secret. It is what it is. And so we needed additional funding. In order to get that funding, some people might say you should go to the private sector to get it. And I decided to go to philanthropy to start, to be able to get enough funding to be able to make up the difference.
Well, what's also going on here is there's an experiment of sorts where I think your hope is you're going to get better outcomes, which could maybe even reduce the cost of care. Is that part of the plan at least?
Absolutely. We're going to measure everything very carefully. We've done some business planning and have looked at what the potential savings are. And there is potentially, in just healthcare alone, in reduced emergency room visits, reduced hospitalizations that may have been prevented, we potentially could save the system $1.5 million. And then if you look at the economic savings, if a parent doesn't have to miss half a day of work to come to the doctor, so they could get their telehealth visit in instead, or they can go to the mobile medical unit, there's an additional potential of $1.2 million in economic savings for less missed days of work, less missed days of school for kids. And so there's a lot of savings that we are expecting this model to prove. And once we do, there may be other ways to fund it.
You know, it would be unfair to say that you're in a total healthcare desert, because there are, you know, community health centers not too far, you know, Roxbury, South End, Chinatown, you've got Boston Medical Center nearby. So what made you see suddenly that, hey, there's something missing here?
Well, I think the health centers and hospitals that are providing care to patients with mass health are amazing. They do incredible work and really are the safety net for families. What I started to realize is that what we expect from a private practice is actually slightly different than what we expect sometimes from some of these institutions. And to me, we should expect the same. And so if we really want to talk about equity, Boston Community Pediatrics is going to do just that. We are going to have patients with mass health sitting one day when we can sit in the waiting room, sitting in the waiting room with patients with private insurance, all getting the same care in the same place by the same providers.
Well, finally, you should mention that if people want to get more information, there's a place they can find that online.
Absolutely. We have a website, www.bostoncommunitypediatrics.org. And there's an email there that people can reach out to if they have questions.
Well, thank you very much for taking the time to be with us.
Thanks so much for having me. I really appreciate it.
Dr. Robyn Riseberg, and we'll have more news in just a moment.